Let's continue this conversation now with Dr. Anand Swaminathan, an emergency medicine physician in New Jersey. Doctor, thank you for joining us again for this conversation. As I just mentioned, you work in emergency medicine. I'm wondering what you're seeing at the hospitals in New Jersey. How are other hospitals that you're hearing about, in New England or in the Northeast, coping that your friends and other colleagues are working at? Are folks running out of space? Are hospitals running out of equipment? What's going on the ground?
We're seeing all of that happening right now. Yes, I think that January is going to be where we really see the peak with these two holidays or a couple of holidays back to back. But we're already seeing a surge from Thanksgiving that's coming, not just in my hospital, obviously across the state, across the region. And talking to colleagues in other parts of the country, they're seeing it as well. They're seeing huge spikes in the number of patients that are coming into the hospital that need to get admitted. And they're seeing huge spikes in critical care and patients going to the ICU, which means in the next 2 or 3 weeks, we're going to start seeing deaths rise again because we know there's a little bit of a lag to that. We are seeing running out of equipment. So, the same equipment that we were talking about running out of in April and May, ventilators, medications, we are short of space. And we keep stressing over and over again, it's not enough to give more space or more vents. We need more staff. And that's something that we're not going to be able to fix anytime soon. You can always ramp up production of certain equipment. It's very difficult to expedite training of staff. And so it doesn't matter how much space we have. We don't have the staff to take care of the patients we're seeing. The hospital system is going to be overwhelmed very soon. And in some areas is already reaching that point.
So, doctor, what aren't we doing that we need to be doing? What does the public need to do, right, to help frontline workers like yourself really get the case numbers absolutely reduced here? Because we keep seeing these record highs coming in day after day.
It's the same thing that we've been saying for 8 months. It's good, simple public health measures: hand washing, masking, physical distancing, and not gathering indoors. And I think that last one has become more and more of a problem. I'm sure that it was a big problem around Thanksgiving. I think it is continuing to be a problem, especially as the temperatures are dropping in the Northeast. People are being forced indoors and they're not giving up those social interactions that we were able to do outside. Now, it's easy to blame individuals for gathering indoors. That's really not the issue. We need good messaging. We need good messaging across the board telling people this is what we need to do. And we haven't had that. We've had such a huge amount of mixed messaging. And even when the messaging has been correct, it's been really delayed in getting to people. So the health professionals have been saying the same thing. That's who the public needs to listen to. Don't gather indoors. Keep your masks on, socially distance, hand washing. That's what we need to do. And that also means we need to start closing some non-essential businesses. There shouldn't be indoor dining going on in any place that's surging. And if you look at the map, that means basically everywhere that's not Hawaii, we need to be stopping indoor dining because that's a huge place for spread.
So we actually have the news, at least here in New York, that Governor Cuomo will be shutting down that indoor dining. I was going to ask you if that's a measure that we need to be taking. Obviously, you just said absolutely. Yes, we need to. I'm wondering if you think that perhaps, and we were showing on the screen just for everyone at home a couple of moments ago, essentially where we have mask mandates, states and cities that are currently in lockdown. In addition, or as a part of some of these public health initiatives, do you think that we need to be more restrictive than we are right now? Because I keep hearing everyone weighing in on this, trade off that we have to have, the trade off of, keeping companies open, keeping restaurants open, with, the fact that the economy needs to also stay open. So I'm wondering if you can weigh in on that argument, if we need to be more restrictive, if more politicians like Governor Cuomo should be warning, listen, hey, if these numbers don't come down, we're going to have to take some of these measures.
We do need more restrictions. And the best way for us to support our economy is to defeat the pandemic. We know this. We have to defeat the pandemic in order for our economy to bounce back. Vaccines have been touted for the last couple of weeks, and vaccines are going to be a huge part of this if everybody gets vaccinated. But that's going to take a lot of time. Even if the vaccines came out today, it's 2 doses a month apart, and then another 7 to 10 days before you really get the efficacy of that vaccine. We're not going to see that for a while. So we need to be doing good public health measures, which means we do need to be closing other parts of our businesses in order to protect people. And again, we have to prioritize. Priority number one should be keeping everyone healthy. I think in terms of keeping things open, priority number two should be getting schools open and keeping them open. And in order for us to do that, in order for us to keep schools open, we have to be restrictive in other areas. That means the social gatherings. I mean, we saw over the weekend there was a big party in New York City in a club. That kind of behavior is unacceptable. We can't be doing that because that is where this virus is going to spread. We're going to be sending people out that are going to be seeing other people who are even more at risk of getting very sick. And then we're going to have peak after peak after peak. So if we want our economy to recover, we have to fight the pandemic properly. And that means good public health measures.
And I want to correct myself. I said earlier that New York City definitely would be closing indoor dining. Actually, it's just a warning that we have right now from the officials in the state that if hospitalizations don't stabilize, they will be closing indoor dining. Doctor, I want to ask you about President elect Biden. And his healthcare team that has been announced. It's including his nominee for the Health and Human Services, and that's going to be California's Attorney General Javier Becerra. Wondering what your thoughts are on his team. He's also included someone that we've all seen before, Dr. Vivek Murthy, for not Attorney General, for Surgeon General. I'm wondering what your expectations are given these selections in the fight against coronavirus.
I'm excited about this team. I'm excited about the COVID pandemic team as well that Biden and Harris have put together. These are critical places that we need to be active. So, Mr. Becerra being in charge of HHS is huge because they oversee CDC, they oversee FDA, which means they're going to be overseeing the distribution of the vaccine, which is going to be the biggest public health challenge that we are going to see in the next year. How do we get this vaccine to everybody? How do we message this so that everybody gets vaccinated? And how do we get it so that everybody gets the first and the second vaccine, since both are going to be necessary to get that real herd immunity that we need to see? Herd immunity is not going to work with 2 or 3 million people being vaccinated. It's not going to help with only 30 or 40% of people are vaccinated. We need a large number of people to be getting it. This is a huge task for HHS. I think Mr. Becerra is up to it. I also love the CDC appointment of Dr. Walensky, who is extremely well respected by her colleagues. She is a public health champion. She has great research behind her, and the collective sigh of relief that I have heard from physicians, from nurses, seeing these people put into the proper positions has been huge. We need to restore the faith of both the population as well as physicians in the CDC, in HHS, because that has taken a huge hit over the last 8 months. If we don't have that, if we don't have faith in those organizations, we cannot overcome this pandemic. And I think that these nominees are really wonderful for us to be pushing science forward and getting everybody on the same page together.
All right, Dr. Anand Swaminathan, emergency medicine physician in New Jersey. Always good chatting with you. Thank you for bringing us some of those insights.
Thank you.